in that whole story, last century, access to healthcare didn't matter. In fact, it wasn't until 1930 that a random person presenting to a random hospital had a better than even chance of being better off. In the 1880s and 1890s, there was one group of hospitals that actually did make you better. If you ended up in a hospital that was run by the medical profession, you're in big trouble. You're better off not there because you're much more likely to die. But if you happen to end up in one of the homeopathic hospitals, you were better off. And that was because homeopathic hospitals were clean. They knew about sanitation. Not that homeopathy works, because it doesn't. And there's no evidence based to it. And if anyone thinks there is, I'm happy to talk to them afterwards. So it's interesting. The hospital system and the health system didn't matter, but now it matters a lot. And in fact, the WHO's argued that 50% of health gain since the Second World War is due to the health system. So it is a major, access to healthcare is now a major social determinant of health, and I'll come back to that in Aboriginal health because I think it's very important. Almirata, I think one of the key things about Almirata, and I'll skip over this, was that at Almirata they realised that comprehensive primary healthcare required a real commitment to a new world economic order dedicated to achieving more equitable health outcomes and a more equitable distribution of resources. So Almirata wasn't just about curative, promotive, rehabilitative and preventative healthcare. It was also about action to address the way the world economy works and to act on the social determinants of health. And that's the foundation principle of primary healthcare. That was immediately, I suppose, rejected by first world governments. And so the Ottawa Charter was an attempt by Canada and the first world progressive people in the WHO to rewrite the principles of Almirata in a language that the first world couldn't reject. Because how could anyone reject health promotion? Whereas they had absolutely rejected comprehensive primary health care. Because when they all came home, and our health minister was at Almirata, there were 136 health ministers there, and they all signed on to it. When they all came home and they showed it to the governments back home, people said, this is setting up some sort of radical health system that's going to challenge our economic policies. What are we doing? This is just nonsense. We don't want to go anywhere near this. And so first world governments very universally retracted from primary healthcare and said, primary healthcare is okay for places like Africa, but it's no good for Australia, America, England. So the Ottawa Charter was an attempt to say, well, let's talk about health promotion. No one can reject health promotion. But in fact, it really didn't work because within a short space of time, by 1990, the World Bank was a much more dominant player in global health policy than the World Health Organization, which was marginalised then and is still marginalised now. But I think in terms of one foundation principle about primary healthcare, I really like, this is from David Sanders, who's from South Africa, who's written some of the best books on comprehensive primary healthcare, including The Politics of Comprehensive Primary Healthcare and Child Survival. But this slogan, primary healthcare is about primary medical care plus public health, and the old and the new. The old public health being what happened in Great Britain last century, so water, sewage, sanitation, housing, what we now call environmental health. The new public health being what started from Almirata on from the late 70s, which is the realisation that we have to achieve global equity and economic equality if we're going to achieve health gain both within nations and between nations. If you put all that together, if we're working in primary healthcare, they're all the fronts we're working on. So we're actually trying to do a hell of a lot. So the social determinants of health, then coming out of that philosophy, if you like, if we're looking at health, you start with individual constitutional factors and you broaden it out to the social determinants of health, like education, employment, income, clean water, access to healthcare, and food production.